Have you heard about Movember? No, that's actually not a mistake. It's not November. Movember. If you haven't, today's show is just for you, and the show starts right now. Welcome back. I am Dr. Mario Torres Leon here at Health, Spice and Life Show, HSL. And today we're going to be speaking about something that is a little bit unusual, and it's actually about men's health. And you may be wondering, well, Dr. Mario, why is it that men's health is actually an unusual topic? Well, as a matter of fact, it is because for many, many years in a man's life, men don't actually go for health care. You see, in distinction with men, women do it differently. And the reason for that is that women are involved during those years of motherhood and being during the years of raising a family and having children. And that leads to women all over the world to constantly be looking for health care so that they can make sure that everything is going fine, they're taking their vitamins, making sure they're healthy so that they can actually have children. When it comes to men, unfortunately, we just don't do it the same way, which is a bit of a disadvantageous situation. Because typically men, particularly those that go for education after high school in developed nations and so on, they go to college and maybe they're exposed to some form of healthcare during those years, and then after that, basically we just die off the curve and we're not looking for care. Furthermore, particularly for all those millions of people watching the show that are part of the Latino community, Latino men are not particularly good at just saying, I don't feel good, let me go to the doctor. It's something that we tend to shy away from. So today, we're making this show be about men's healthcare and about creating awareness. As a matter of fact, one of the most common causes of death for men, in fact, the second one, is actually prostate cancer. The number one being lung cancer. And we want to bring some awareness and some attention to that in particular. As it turns out, African American males are the ones that are most affected by this form of cancer, particularly here in the United States where we're filming from, according to the American Cancer Society. Those men who are African Americans, they have a higher incidence of prostate cancer, particularly those who've had a family member that have had prostate cancer, and if they're on the ages of 40 or above. In the case of white males, it actually happens to be older white males, and that affects men in the ages of 65 and older. But this is a very important thing to actually be paying attention to, because prostate cancer can be absolutely devastating, and it is something that we can address and care for. Now, you may be thinking, well, what can I do to prevent this kind of cancer? Well, in fact, the risk factors that have been associated with prostate cancer have to do with obesity and the consumption of animal fats. So staying in shape, being able to address it with a better diet, and I'll talk about some of the things that you can do that can improve your diet and ultimately hopefully decrease the risk of prostate cancer, are super important to address this. What else can there be? Well, if you're not a very active male, you're not exercising, that can also contribute. In other words, your lifestyle that leads to that obesity can contribute to higher rates of prostate cancer. What can you do in terms of your diet? Number one, some of the studies that have been done have proposed that you can actually have soy in your diet as a way to reduce the intake of dairy, which can actually lead to some of that fat accumulation, and also the intake of vitamins such as vitamin D and vitamin E, and minerals such as selenium. Now, on the side of vegetables and fruits, tomatoes have actually been associated with a protective effect, if you will. Now, once that we know that, the other thing is, where's all this Movember situation coming about? Well, as a matter of fact, in 2003, in the country of Australia, a movement started to create more awareness, particularly around the subject of prostate cancer and testicular cancer. Once again, men we don't tend to care for ourselves in the same way that women do. So this is a way to say, okay, we have to be having this conversation and talking about it. And this is really important because the number 8 country in Latin America with the highest reported number of cases of prostate cancer, believe it or not, is the island of Puerto Rico. So this is something that is not just a disease of African Americans, it's not just a disease of older white males, but it also affects Latinos as well. In fact, 1.3 million people globally every year are the ones that are being pretty much diagnosed with prostate cancer. So Movember is about creating this conversation and this awareness. And in fact, this organization, Movember, which you can find online at movember.com, has created over 1,250 different campaigns to create this global education and awareness for men's health. And now they've actually transitioned to a lot more than just doing prostate cancer and testicular cancer, but also going into mental health. So if you have not heard about Movember, I strongly invite you to actually do that. Take a look at it, because you may be involved in some of these programs to create local awareness in your community. And more importantly, as men, it is so essential to be looking forward to receiving that care so that we can impact our local communities, care for ourselves, and also bring that great health to our family. And also, we can be the ones saying, as opposed to just women who are very aware of diet, that we care about that by just bringing some of these elements that we've discussed in the show. Before we complete today's show, I also want to bring to the attention that our dear brothers and sisters in the countries of Honduras and Nicaragua have been completely struggling over the past couple of days and weeks because of the two hurricanes that went by, Ida and Iota. So our hearts are absolutely with you. Wherever you may be watching from, there's a lot of Nicaraguans and Honduran people that look at our show, and we're completely connected with you. So my heart and the heart of our production crew goes to all of you, and we really look forward to seeing that this passes and your nations can come alive again, come back again. So our hearts are absolutely with you. And as we like to say in every single show, from my heart to your heart, I am Dr. Mario saying to you, a tu salud. See you next time.